I'm Dr. Wendy Lee, obstetrics and gynecology. I wanted to become a physician because I wanted to enter into a service occupation. I tend to do better working hands-on, being on my feet, interacting with people, and I wanted a job such that I could go home every day and feel like I've done something to help fellow members in my community. I like OBGYN because I like the idea of being an advocate for women's health. The most obvious difference is I'm the only female in the practice, so I think from that perspective I can have direct empathy in journeying through a pregnancy and delivery and postpartum experience. I think there are two factors that are of equal and vital importance. Number one is trust, because patients want someone that will maintain confidentiality, that will give them, there's a bevy of advice on the internet and some can be accurate and some not. So it's nice to have someone that you can entrust in being your gatekeeper and given the appropriate medical information from a really non-biased and non-judgmental standpoint. Patients trust us with some of the most sensitive information that they have in their lives, and they want someone that they can talk with regarding that in a non-judgmental way. The second factor is approachability, because the patients aren't going to, they're going to be reluctant to divulge medical information to somebody if they're intimidated by them. They want somebody to be seen as more of a friendship standpoint sometimes than just an authoritarian standpoint. I have two children. At this time they're aged 15 and 12. They're in quite a few activities, so we enjoy going to their activities. We're marching band parents, soccer parents, academic team parents, so they alone in our spare time keep us busy. We like to travel quite a bit, and we'll typically budget more money for travel than we will material items. And I like to exercise. That I feel like is my outlet. I actually get up at 6 days a week at about 5 o'clock and exercise and have it done, and any anxiety or uneasiness or anything I have that day is gone at that point, and then I just have the rest of the day to be a little more clear and focused.